Chairman, we are now live.
Thank you very much, Nikki. A warm welcome, and a very warm welcome tonight. We've got jackets off because it's already quite warm in this room. That's even before we started debating the important issues that we're going to be talking about tonight. But a warm welcome to all of those attending in person and anybody who's watching on our YouTube channel, Hillingdon, London. This is a meeting of the External Services Select Committee. My name is Councillor Nick Denys, and I'm the chairman of this meeting. A key role of this committee is to monitor the performance of local public services within its remit and hold in-depth reviews on topics of resident interest. We engage with a range of external witnesses in our activity, which can include community group, residents and subject matter experts. Where we identify areas for changes or improvements, we make recommendations. I mean, this can be to our cabinet, but it can also be to the external bodies that we scrutinise. Details of the business to be considered tonight is shown on the agenda. If you're watching on YouTube, it's underneath the broadcast. For those present in the room and intend to speak, please note that you'll be filmed and any statements you make will be recorded and made public. For those in the public gallery, you won't be on camera. A reminder to councillors, officers and those speaking today that you should turn the microphone button on when speaking and it'll go red so you'll know when it's on. This will ensure that you can be heard in the room and by those watching online. When we come to our main item, I'll do a little bit of an explanatory piece about how it's going to work, because it's a bit different at the moment due to coronavirus, plus the government legislation forcing us all to meet in person. But I'll cover that at the beginning of item 7. So, first of all, I will go to item 1. Nikki, are there any apologies for absence?
Chairman, we've had apologies from Councillor Radia and from Councillor Simon Arnold, and Councillor Nicola Brightman is here as his substitute.
Okay, thank you. Any declarations of matters of interest coming before this meeting? No, fantastic. Item 3, the whole of this meeting is in public, isn't it, Nikki? Yeah, excellent. So there's no exclusions. Come to item 4, which is minutes from the 28th of April, 2021. Does anybody have comments on those minutes? No? Fantastic. Item 5 is minutes of the meeting on the 29th of April. Any comments? No? Fantastic. And item 6 is minutes of the meeting on the 20th of May 2021. Any comments? No? Fantastic. And a big thank you from me to Nikki for preparing all those minutes, because having 2 meetings and quite long intensive meetings at the end of April, turning that round within in the time frame of this meeting is very, very impressive. So thank you very much, Nikki. Right. So that brings us on to our main item for today, which is item 7, the Children Dental Services provision within Hillingdon. Before I start introducing this item properly, I just want to give a little bit of background of maybe how we're going to do this piece of work, which is slightly different than how we normally would do this piece of work. Because normally we'd have one meeting and there'd be a few more external people coming to speak to us. And then at the end of it we would think about recommendations. But understandably, a couple of people have said that they do not wish to attend in person. And I've already had a meeting with Andrew Biggerdike, who's from Public Health England, and we'll plan a couple of other meetings with people such as Hillingdon Health Watch to get some further evidence. What I would like from the committee is if anybody's interested in joining those sessions, they'll be informal sessions, but I'm very happy for you to do so. It'll be on Teams, for example. Obviously, those of the committee members who can't attend those meetings, we can give updates to them, so in order to collect more information. You'll notice that there's a laptop in front of me, and the laptop is on, and on the laptop we have Dr. Andrew Reid, who is Consultant Clinical Director of Dental Services at Whittington Health, a very important stakeholder in this. And the reason Dr. Reid is on his laptop is because he's self-isolating at the moment, and we found out at midday today, and he was meant to be attending, but Nikki thankfully came up with a fantastic solution to make sure that Andrew could still be here for the meeting, which is important to us. So you'll hear his voice, but only me and Nikki can see him. But it's obviously hot where you are, Andrew. I can see that as well, so thank you. So yes, and so ultimately we'll collect some great evidence from this meeting, and then hopefully by the next meeting, or certainly by the September meeting, we'll be able to have a report on recommendations that we as a committee can sign off and discuss. And Councillor Brightman, you're very welcome to continue with our discussions on this, because I know you're only temporary tonight on the committee, but obviously you've been sucked in and have an interest now, so you're welcome to contribute to that as well, even though Simon will have voting rights in the end. So yes, so does anybody have any questions about any of that? Councillor Nelson.
Yes, thank you.
Sorry, could you put your microphone on? Sorry, thank you.
Under the select panel, the witness session we're supposed to have that we weren't able to do because of COVID, you're now saying that we will go ahead because some people don't really want to be part of the discussion. Is that mean that the time scale that's selected here with no dates at the present time on page 28, will that no longer go ahead? Not page 28, page... okay, that will be under action or work program. So the first panel we had the first meeting.
Yes.
So is there no other meetings will be taking place, or are we just going to go according to what you are discussing here, what you said about others who don't want to attend but will go ahead? Can you clarify that?
I certainly can. Thank you, Councillor Nelson. So, a long time ago, about 2 years ago, this committee decided that we would do what do you call it again, a special panel?
A select committee review.
It's a select committee review, and that involves setting up a subgroup and a number of meetings in more of the traditional sense that a committee would operate. Then COVID happened, and essentially all those meetings and the timetable ended. So the choice that we had was, do we set it out in the same way that we did previously, or do we drop this issue altogether, which I didn't want to do because it still is a very important issue. Or I thought, having read the evidence already collected, which Nikki put in the paper very well, I thought there were a lot of key themes that actually we could tease out in one meeting and come up with some good recommendations within the next month or so. Within this meeting, it was ideally just going to be this meeting, but we'll have a few separate meetings due to the COVID circumstances that I suggested earlier. So essentially, we will be able to, by the July meeting or September meeting, come up with a paper with recommendations to hopefully improve the situation. So the timetable that you're looking at was the previous timetable that was agreed 2 years ago, but that's all fallen by the wayside. Obviously, if we get to July or September when we look at the paper and recommendations, we think actually we should dive into this even deeper, then we can talk about adapting the work plan for that. I mean, my feeling is, and we'll see at the end of tonight, my feeling is that, the research that we've got and also some of the things that have been uncovered, that we can do some good work on this within the next couple of months. But ultimately, I'm open-minded to what the committee come up with. Councillor Nelson.
Yes, so that means that the possible key lines of inquiries that will take from number 1 to number 19, are those the ones that we will be hearing?
Councillor Nelson, can you put your microphone on, please?
Can get used to it.
People watching on YouTube can't hear if we don't have our microphones on.
I'm so used to Zoom. My apologies. Just the possible key line of inquiries on this document here from number 1 to number 19. Are those the lines of inquiries that we will be going along then? Is that what you're suggesting?
So these are questions pulled together by Nikki, who thought they might be helpful for us to think about. So the answer is it's for us to pick and choose. So if you think some of the questions are good questions and good lines of inquiry, then follow them up. But obviously, if there are other lines of inquiry that you think are important, follow those up. So these are just suggestions for committee members to use if they wish. Ultimately our goal is to improve the oral health care, especially of 0 to 5-year-olds, which, as we'll have seen from the report, in Hillingdon is, I think, unacceptable, really. So whatever direction you want to go in order to help achieve that, go in that direction. Okay, thank you. Okay, if everybody else is okay, shall we dive into the meeting? So let's do introductions. So I've already introduced Dr. Andrew Reid. We also have here Dr. Lalit Patel, representing dental practice in the borough. Thank you very much for coming along, Dr. Patel. And we also have Shika Sharma, consultant in public health. Yes. Hello, thank you very much. So my plan is to go to each of you and ask you just to talk a little bit about the subject if you wish to. I suppose the key points are, why is the situation so bad in Hillingdon and North West London for 0 to 5-year-olds? And is anything being done to try and improve the oral health of that cohort in our borough? So those are the sort of two things I think would be very interesting to hear your opinions on. Could I start with you, Dr. Andrew Reid, first of all? I think you're still muted, actually.
Sorry, can you hear me now?
Yeah, we can hear you now. Excellent. Can everybody in the room hear Andrew? Brilliant. Okay, thanks. Go for it.
So I'm here with two hats on, really. The first is as a clinical director of Whittington Health Community Dental Service, which provides some of the specialist paediatric dental services in the Borough of Hillingdon. And we also provide a number of oral health promotion programs in the Borough of Hillingdon. So that's in terms of my role as a clinical director. And then I'm also here as a representative of the Paediatric Dental Network for London, which has come together during the pandemic. And I can tell you a little bit about that. And maybe that's probably a good starting point. If you're agreeable, I'll just sort of outline what the Paediatric Dental Network for London is and what our priorities are. So the Paediatric Dental Network for London is formed of clinicians in the NHS, largely working around paediatric dentistry, and I sit on this London-wide group representing North West London. And the main focus for our work, and this is, some of it is pandemic related, the main focus for our work is around, first of all, there is a huge problem across London with the backlog of cases for children who are waiting for general anaesthesia to have dental treatment. And so our first aim is to try and increase capacity. The second aspect of our work, the second focus for our work, is to develop networks with local dental practices that have an interest in paediatric dentistry and supporting skills development in those practices, specifically around the care of young children. And then the third focus for the London Paediatric Dental Network is supporting what I would call upstream evidence-based public health programs, because essentially the main driver for the general anaesthetic cases which we're struggling to provide the capacity for, the main driver is tooth decay in children. And this wasn't a creation of the pandemic. Pre-pandemic, there was a similar problem, and you've outlined and summarised quite well that for 3 and 5-year-olds, the levels of tooth decay in children in Hillingdon are some of the worst in London, but by no means the worst in North West London. So I think those are our priorities, whether we're talking about London as a whole and whether we're talking about North West London. As to why Hillingdon and some of the other boroughs in North West London have higher rates of tooth decay in children, I think it's probably a complex picture, and I don't think it's something that is very easy to tease out. So I don't know whether I can state with any certainty what the cause of the high rates of tooth decay are. It's multifactorial, I think. But what we do have to focus on are the strategies to, first of all, improve the access to services, and then secondly, to reduce the level of demand. And reducing the level of demand is going way upstream in the pathway, and that is preventing tooth decay in very young children. In terms of our provision of oral health promotion programs in Hillingdon, I can summarise some of those programs, but I would say overall there is quite modest oral health improvement programs in Hillingdon. They comprise, for example, a small supervised toothbrushing program in schools, which is a very effective way of preventing dental tooth decay in children. We distribute toothbrushing packs through mainstream and special educational needs schools. We carry out train-the-trainer sessions targeted at health visitors, children's centre teams, early year settings, home start, childminders. We run frequent campaigns in Hillingdon around National Smile Month, Fizz-Free January, and we provide a number of resources around this, newsletters, videos, and so on. But I would emphasise that the level of oral health promotion activity that we have in Hillingdon is quite modest and probably falls short of that required to really properly address the level of tooth decay that is prevalent in Hillingdon. And I think I'll leave it there for now, because the only other thing is to talk about services, and we provide specialist paediatric dental services from our Uxbridge site, and we take referrals from general dental practitioners. What we do know, London-wide, and I think this is the same in Hillingdon, that access to general dental practitioner services for children has been significantly impaired by the pandemic, and we certainly get quite a number of reports from parents who have difficulties accessing dental care in this way. So I'll leave it at that for now, but obviously happy to come back in then when others have spoken.
Thank you very much, Andrew, and I'll let the other two guests speak as well, and we'll do questions, and anybody can pick up the answers after we've had the other speakers. Anybody want to go next, or shall I pick? Who shall I pick? I'll pick Shika. Yeah, Shika Sharma, can you go next? So yes, why do you think the issue is so bad in Hillingdon? And for those who are watching maybe and haven't read the papers, in Hillingdon, 32.5% of 0 to 5-year-olds have dental decay, which is, scary really, and that compares to about 25% in London. So, the situation in Hillingdon, I think is pretty serious. So why do you think that might be the case? And if you have any ideas about maybe how we could improve that, that would be really useful. So thank you.
Absolutely. So, as Andrew has already said, dental caries is the cause of, highest number of hospital admissions, and also it is an important public health issue. So, me as a public health consultant, I absolutely agree that we need to prevent more rather than treat. So based on the hospital episodes data, we know that the admissions are the highest for children aged 5 to 9. And the figure, 32.5% of Hillingdon's children have experienced dental decay, makes us significantly worse than England as well as London, our regional area. So in terms of why Hillingdon, as Andrew already highlighted, it's northwest London. And we have been looking into various things, i.e. deprivation, mobile population. We also are learning that, in Hillingdon there are about 4,000 births every year. So there is something about we need to have sustained effort. We can't have ad hoc programs where we give toothbrushing packs and then for a year or 2 years, and then the intervention doesn't happen, and then we are missing children for the years that we don't do awareness campaigns. So there's that aspect. In the past, we have worked on improving access to dental services. So, because one of the issues is that parents are either not aware, either due to lack of awareness about NHS dental services, or simply due to trying and not finding access easy. So there have been reports in the past where parents have tried to access dentists and have been refused, saying, no, we are full, you can't be registered. Now, registration has not been required, registering with dentists has not been required since 2006, and not many people know that. So I think it's also about educating our population, where we as local authority can play a role, and we have in the past worked with the NHS to organize a campaign in the Pavilion Centre. We've improved access by providing 2 new NHS dental practices in areas where there was no NHS dental provision, i.e. in Harefield and in Useley. So that has been sorted. We also need a sustained action across early years settings to promote breastfeeding instead of bottle feeding, which has a detrimental effect on oral health, causes dental decay. Healthy weaning, we need to promote good oral hygiene amongst parents and children in early years settings, so that we target them early. And we've done some of that through providing toothbrushing packs. So that project has been going on in Hillingdon for a while. Another thing that we've done is in early years settings, i.e. children's centres and nurseries, over the past many years we've improved the awareness and understanding among staff and among parents about sugary foods and snacks, and excluding those from children's diets. So there have been train-the-trainer sessions, there have been cook and eat sessions when we had health promotion provision, and there have been other initiatives to improve young children's diets. There was a fluoride varnish project as well. So where there was dental decay noticed, we worked with dentists and schools to do fluoride varnish to prevent the further decay in children's teeth. So there are a number of initiatives. We know that dental decay is strongly related to deprivation. So if we target areas of high deprivation, we will tackle this issue. And we have tackled it in various ways, doing different initiatives, but we do recognize that it requires a consistent approach, because we are getting 400 new children every year, babies who we have to work with. It's not just we have to. So there are a number of things we can do, starting with maternity services, where we target women who are pregnant, raising their awareness about not only just their dental health and going to the dentist, but also them being a captive audience, engaging them into discussion about how and when to start looking after their baby's teeth when the first tooth appears, and how to access dental services. So we can start with maternity, but also work more with schools. Another aspect is that in some ethnicities, due to the diet, it might be an issue. So work with identify where those communities are and raise awareness there. and also work with schools and improve diets in schools. So those are the things. At a strategic level, the timing is good because there is a children, young people's strategic group set up, which is now attended by public health, and they are looking at prioritizing areas for monitoring, and this is where NHS is present, public health from local authorities present. I think the local GP services are there as well. So together we can look at the oral public health. And also there is a new children, young people's dental public health, dental health group, oral health group, set up by the Children's Commissioner, Carol McLaughlin. And that is attended by Whittington Health. I attend it as well. And under that, a number of initiatives took place, that some of which Dr. Andrew Reid has highlighted.
Sorry to interrupt. Is that specific for North West London, or is that a national programme?
No, that's for Hillingdon.
For specific, even for Hillingdon?
Specifically for Hillingdon. So we have a strategic group for Hillingdon on children, young people, where oral health is being identified as a priority. So we will have some key indicators relating to oral health as part of our ongoing monitoring strategy, but also this children and young people's dental health group, where partners are looking at things together, and it has been working throughout COVID pandemic, and Sally McGregor, the oral health promoter in Hillingdon, is part of it, and she has done some fantastic work, web-based projects with parents and young children, involved early year settings. She's involved schools, and there's already a supervised toothbrushing program in the pipeline, working with 10 schools, and that's funded by NHS England. I think the key issue, if I may identify, at this point in time, that's been fed back to me from different sources, is access to NHS dental services. It seems like there is a system, however, there are issues with parents accessing services, sorry.
Okay, thank you very much. Okay, fantastic. Obviously, we'll come to questions to everyone at the end, and I think that brings us very nicely to our third speaker, Dr. Lalit Patel, who represents the dental practices. So, obviously, I'll put the same two broad questions to you, and obviously at the end of there was a question about access to NHS dental services, which obviously we'd love to get your opinion on as well. So, sure. Thank you.
Hi, I'm Lalit Patel. I'm the chairman of the Hillingdon Local Dental Committee. And we're a confederation of, we joined the confederation of 19 local dental committees in London. So we work as a big group as well. And I think to give you some background on how this stems up is that, as Sheikha mentioned early on, in 2006 we had a new contract given to all the dentists on the NHS. And what that contract did was, it gave you a figure for your practice on a historical basis in 2004, and it said that this is the sum for your practice, an X amount. In return, you have to achieve number of unit of dental activity. Now, it's these units of dental activity. You could either spend the whole contract on looking at children, or you can either spend the whole contract looking at adults. So there's no sort of given means of measuring how many you spend on children and how many you spend on adults. Now, each practice, so there's no scope for growth for any practice. So if you want to see new patients coming in, if you don't have the funding, you can't see them. And that boils down to budgeting. If you do not achieve your activity within the year from April to March, that used to be ring-fenced many years ago. It's not ring-fenced anymore. So if that funding is clawed back, it's never spent back into dentistry. So it's gone. As Sheikha mentioned, there were two areas which were of concern, one in Useley and one in Harefield, and new practices have been set up by funding given by NHS England, and that's a good thing that happened. Unfortunately, that's not enough. I'll give you some background on some data which I have, which from 2019, and the population of Hillingdon then was 309,000, and the total spent on general dental services in London itself was 391 million. In Hillingdon, I think Hillingdon came 22nd out of the 33 boroughs for the NHS spend. There are 33 dental practices in Hillingdon which provide general dental services under the NHS contract, of which there are 103 active dentists working in general dental services in Hillingdon. There might be more now. This is 2019. Unfortunately, I'm not privy to any data after this. The point is that we are really working on a budget, and that budget unfortunately doesn't allow us to expand. It doesn't allow us to do a lot of preventative work that we really want to do in practice, like Sheikha mentioned early on, and I think Andrew did as well. The CYP group that we have, and I'm part of that as well, I attend those meetings that we have. I think we've got one tomorrow, which Children and Young People's Group, which is doing some marvelous work in there. And I think if they were funded with the council, the way forward is to fund them or to give them some more encouragement, and then they would come up with they're doing some marvelous work with nursing mothers, bottle feeding. Bottle feeding is one of the most highest cause of dental decay in children, because people don't wean out bottles for so many years, and that causes dental decay as well. The other thing was that access is a big problem, and with the pandemic, it's even become more of a problem. So where would children, or where would people who need dental services in the borough go for treatment? So say if you haven't been to a dentist for 5-6 years, you're not registered with the practice. You have to find a dentist yourself, and you have to find an NHS dentist. You ring up Health Watch England will tell you. Health Watch England will tell you as well that very, very difficult to get a practice which will accept you as an NHS patient. We have about 250 people waiting on our waiting list to join the NHS list, and we haven't got capacity for them. And we're working with the new way of working, where after doing a certain procedure, you have to leave the room, come back in after half an hour, clean it, and then go back in. So it's really very hard work and very tight budget, very tight timeline that we're working on. But apart from that, the problem is that there's no registration, as Sheikha mentioned early on. So if there's no registration, you could go and see dentist A, and then you can go and see dentist B down the road as well, or dentist C, whosoever you want to see. You're not registered like a doctor with a specific dentist. That used to be in the past, not anymore. Unfortunately, the contract itself is really doomed in a way, in my opinion, and it's due for renegotiation, and they're doing contract reforms, and I think that will come into play hopefully April next year. But in the meantime, if people struggle with finding a dentist, the NHS England and NHS London commissioning team have created urgent care centres. So I think in Hillingdon we have about 4 urgent care centres in Hillingdon. So if they ring NHS 111 and ask to be directed to the dental part of that, they can channel them to the urgent care centres, which will provide them with some urgent dental services. This is mainly children and people in pain. In my opinion, the way forward is water fluoridation. The white paper has outlined this and said that water fluoridation is a must now to prevent dental decay, and I think they have passed that in the Parliament. Also, contract reforms. So how would contract reforms help? Well, if you have a set budget in your practice, and if they say of the set budget, you spend an X amount on children, an X amount on adults, an X amount on nursing homes, or an X amount on domiciliary visits, that would be a better way forward for me. So I think there's a lot of things in the pipeline, nothing positive yet, but unfortunately this contract has been running for about 12 years or so. It's really doomed. So I don't have any positive news except for what I recommend.
Well, hopefully we'll find something positive in our discussion
Thank
as we
you.
go forward. Can you just turn your mic off? So I will take chairman's prerogative and ask a couple of questions, and I'll ask for people to put your hand up. I see, Peter, you've already put your hand up, so I'll let you down. But okay, interesting. Right. I suppose I've got so many questions, but I'll just stick to a couple and let other committee members come in after a couple. But my first question is around what happens if access to an NHS dentist is refused. So obviously you've said that somebody might not be able to find an NHS dentist, but we know that somebody's looking for an NHS dentist, and then we know that person doesn't have an NHS dentist. So surely there's a flag there that this is a person who is at risk of not getting the dental treatment they need. I mean, do we do anything about that? Who would like to answer that?
I think I can answer that. I mean, if you're a regular visitor to a practice and you've got relationship with them on the NHS or whatever, then surely they'll look after you if you have a problem. But for people who haven't got a dentist itself, that's why NHS England and the London commissioning team have got these 5 urgent care centres. So they will be pointed towards the 5 urgent care centres.
Yeah, but the urgent care centre is not satisfactory.
Nope.
It is of course satisfactory if you have a terrible pain and you want to remove that terrible pain. But really, what you know very well that a dentist gives advice, pre-care, spots things early, the idea that we've got 5-year-olds going under general anaesthetic to remove teeth is just not a positive thing. So is there anything done to sort of support these people who can't find an NHS dentist? I'm looking at Andrew and Shiko. Is there anything? I mean, if people aren't able to get an NHS dentist for their child, because of course it's a right for the child to have free dental care, and the urgent dental care obviously must happen, but we need to do stuff beforehand. So is there a way of picking up support for these people who can't find an NHS dentist?
I think Andrew will be in a better position to answer this, but what I can say is what's on the website, which is to call NHS 111. If you cannot find a local dentist, it will see you urgently.
Andrew, do you have any views on this issue?
I'm not directly involved in the commissioning of dental services for access, but in theory, it's the Secretary of State for Health whose responsibility is under the NHS to secure access for everybody who needs NHS dental treatment. But clearly, there are areas of the country, I think less so in London actually, where access is very difficult. I think the pandemic's had a huge impact on access, and I think dental practices, for understandable reasons, have found it very difficult to recover back to the level of provision previously, and hopefully that recovery will continue. I think the other thing to point out is that there is an inverse care law in healthcare generally, but in dentistry in particular. The people have the highest need for dental care. In other words, the young children with the highest rates of dental decay will come from families who access services the least. And I think I've been around working in NHS dental services for over 30 years. And every now and again there's a campaign to try and improve access. And generally, they largely fail, which is why the upstream activities to reduce the prevalence of tooth decay in the first place is probably of more importance. Because just to give you, one thing that was quite interesting during the pandemic, the government brought out a white paper on reorganisation of the NHS, and it got a lot of publicity around the reorganisation, but there was one very small phrase in there linked to dental health, and that was that the government was going to make it much easier to fluoridate water supplies. And it's a bit like the penny suddenly dropped for the government. Why are we spending all the money and all the effort trying to treat dental caries in children when actually, to put some fluoride in the water, it would improve oral health, and it has the effect of reducing inequalities. It's quite a remarkable effect, actually. But the problem in London is you can't fluoridate the water supplies. There are several suppliers, but largely you've got 32 boroughs. So it's an impossibility. So what's the next level down? What's the next best evidence? And the next best evidence are schemes whereby you're delivering fluoride to young children's teeth in schools and nurseries. And to give you an example, we ran fluoride varnish programs in 2 boroughs in north central London, which previously were in a similar position to Hillingdon. They were in the sort of bottom 10 of the league table for dental caries. But through, and there was a lot of investment in it, I'll have to admit that. But by investing in fluoride varnish programs, delivering fluoride to particular settings, now, 10 years later, the level of caries has shifted those boroughs right onto the other half of the table. And as part of the program, we were also signposting children to a dentist. And the evidence was that when we were doing the fluoride varnish program and identifying children with tooth decay and saying to the parents, by the way, we noticed your child had some tooth decay, go to the dentist, they were actually going. So it was a kind of it was a double impact. They got the fluoride, and they got signposted to a dentist. But I have to emphasise that they're quite, it's the most expensive type of oral health promotion because it's generally labour intensive, and yes, it costs more money than quite a lot of other simpler schemes, but it's very effective. So the focus on services and access, I think, is a good one, but it's not necessarily something that's led to improvements in oral health.
So, could you provide where we can find evidence of that to Nikki? Because obviously, as we look at case studies of what has worked, even if it requires investment, it will be very useful to us. Who made the decision to bring in that program and fund it?
Well, the statutory responsibility for commissioning oral health programs lies with local councils. And there was, at that time, between myself and the Director of Public Health, and this was an era when there was some money around. We might not see that era again, I suspect, but there was money around, and the Director of Public Health, who wasn't medically or dentally qualified, but knew how to get.
Oh, sorry, you've just gone on mute, Andrew. What is the? And he's just frozen. Okay. Well, hopefully Andrew will come back. I can see him mid speaking, but I think that was very, very useful. Okay, I've got lots more questions, but I'm going to pause because we have other committee members here. So. Right, so sorry, Andrew. I'm just going to move on to questions from other committee members. But that was very useful. Thank you. If you could provide that sort of information to Nikki, so we can see the evidence, that would be very useful for us about the effectiveness of those examples you gave. So thank you.
Yes, happy to do that.
Very much so. So okay, Peter, you had your hand up.
Thank you, and thank you. That was very interesting from all 3 presenters. A couple of things. Access to dental services is limited. How is a space freed up, apart from the obvious? If someone isn't attending within a certain amount of years, does that then free up the space in the practice? Or is it just once you're on there, and you're just using the service, even though you're not technically using the service? Can that not be reformed now?
Well, it can be reformed, but then you're only meant to do the units of dental activity. So it all depends on, say if you haven't seen somebody who hasn't been to see you for 5 years and they need 12 fillings, and those 12 fillings, you're going to get 12 units of activity for that. But say somebody who hasn't been to see you, that unit of dental activity could see 12 checkups. One checkup is 1 unit of dental activity. So people who have not been to see you for a long time may have high needs, and high needs take a lot of time, take only 12 units of dental activity to do a lot of work. Say you need 15 fillings, you still get 12 units of dental activity for that. Whereas if you have a child who needs fluoride application for 1 unit of dental activity, you can see 12 children in that. How to free up access? That's a very good point. Access is the biggest problem, in the sense of, because there's no scope for expansion and you have limited budget per practice, you can't employ a third dentist and say, look, we got 210 patients waiting to see you. You can see them as of tomorrow. No, you can't, because that budget that you have allocated to the whole practice, you will not be able to pay the new dentist that you're employing. And because the whole contract which came in 2006 ring-fenced all the growth opportunities that you had in the past, if you wanted to work from 7 to 7 in the evening, that's up to you. You were paid on per activity that you used to do. With the unit of dental activity, you can't do that. Your budget is ring-fenced. So there's no scope for expansion. There's no scope for growth. So if you keep your doors open 12 hours a day, you still have to reach that budget, and that's it. You can't do any more than that unless you do it privately.
You're fighting a losing battle here. So social, economic and deprivation is a big factor. Do we have data ward by ward? And do you think that would help this committee possibly identify areas? And the CYP group, the young people group, you speak quite highly of them, you both do. Yeah. Is it worth having a witness session with them just to see what ideas they've come up with, just to see what's going on, and maybe see how we can support them, really, if they're doing such good work? Maybe we can incorporate that. And from Dr. Reed's last comment, it's the statutory duty of the council for any kind of programme for its locality. So any information we can have from the CYP group and any recommendations that we can make could have some direct action and help the residents. So yeah, I mean, I welcome meeting with the CYP group through yourself, Chair, if everyone agrees. I've got a couple more questions. In fact, I've got loads of questions, but I'll hold fire for now. I'll hold fire for now, because I'm sure other people have got loads of questions as well.
I mean, meeting the CYP group, I think, sounds like a really good idea.
Yeah.
I've been handed ward-level stats, actually, from Nikki, which is fantastic.
Well, I
won't
do?
read them out, so they are
they're not in our pack, because I did try and look for them.
No, they're the extra special pack I have up here with me.
If you could share those, please, Nikki, that would be helpful. Thank you.
Dr. Patel, you had your hand up.
So you mentioned the ward-by-ward data. I think I have access levels to dental services ward-by-ward in Hillingdon, but that goes back to 2018. I mean, I'm more than happy to share it with Nikki, and I'll send you an email with the breakdown. I mean, that might help, or it might be a benchmark to help.
Yeah. I mean, I've got, I know Hina's going to come in a second, but I've got a question built on what you mentioned about the data, because it seems obvious to me that there are some sort of high-risk factors which, you know, must point towards a need to get in for early intervention. You know, if a child is not registered with a dentist, number one, that's a big high-risk factor. Number two, if the parents don't go to the dentist, I would suggest that's a high-risk factor. Number three, if they're bottle-fed or you know, other sort of dietary issues, then that's a high risk factor. And then obviously at a broader level, dental issues are linked to areas of deprivation. Those are high risk factors. I mean, do we do anything about mapping those high risk factors and then identifying key groups and providing, you know, services such as, you know, the fluoride to those key groups? Do we do anything like that?
Councillor, we carry out needs assessments and we did carry out a needs assessment a while ago on dental public health, but we do know where people are, and through working with maternity services we can identify the risk factors early, and there are also opportunities for health visitors to identify these families at an early stage and work with them, and some of that work does happen. But I think there is an opportunity. We are in the process of looking at our 0 to 19s, that's services, public health services for children aged between 0 to 19, and that is health visiting services and school nursing services. So there is an opportunity to look at how we build in these requirements to do more work with children from very early age. I think in terms of needs, we do have some idea of where the populations are. We need to engage, and in the past what we've done is we've given out messages, but what we are recognizing post-COVID and from learning from our experience with COVID is that we need to also listen to people. When we give out messages, we say a lot about giving out messages. We need to address their worries, fears, barriers for them, and that some of that work will, this issue specifically will benefit from some of that work. So, for example, what are the barriers to, having more children breastfed, learning about that? What are the barriers for healthy weaning for children? So giving them healthier foods rather than giving them sugary snacks and drinks from an early age. Is it the cooking skills for mums? So some of those issues are very community-based, very intrinsic to certain populations and families.
Yeah, I think that's all really great stuff, and dental issues are linked to other factors, and it's really important to remember that. It's one of the reasons why dental issues are so important. I mean, but what I would instinctively right now would like to sort of think about is, okay, if a health visitor knows that a child's being bottle fed, their parents aren't registered at the dentist, then can we offer the sort of fluoride brushing to that child? Because that child immediately goes into this massive red zone, as far as I can work out, in terms of potential risk. So in terms of, I think doing that sort of targeting on a more strategic basis for me seems like there are factors that people can pick up on. Because I know I've got young children, and you do have this health network built around you, but absolutely zero dentistry in that health network. I mean, something for me, when you get the red book, as a new parent, you're absolutely scared because you've been given the responsibility for this life and you have no training. You go, how, when they first shut the door when you get home, you think, how am I going to do this? And you've got this red book and it's all about the health, and that's, you sort of cling to that. There's no dentistry in there. The only time I knew that I should be taking my 1-year-old to the dentist is when our dentist said to us, you've got to take her. And it's fantastic, and we do, and I'm actually going on Friday with my 2 girls to the dentist. But as I knew nothing about dental hygiene and the importance for kids, and the fact I should be brushing gums from an early age and all this sort of stuff. So anyway, so that's just gone into a little bit of
So these days, mums access a mother and baby app, and I had asked the developers of that app to include dental health, but I'm not sure whether they've done that. I had asked them pre-COVID when I was at a meeting where they presented, but I can follow that up. But in terms of giving toothbrush, toothpaste packs during the COVID period, so between March 2020 and March 2021, 3,180 packs were supplied to schools, looked after children's teams. The Hillingdon Hospital looked after children's teams, school nursing teams, 600 packs supplied to special needs schools. So, behind the scenes, the children, young people group, they have been targeting specific vulnerable populations. So the distribution is happening, but perhaps it was a bit limited during COVID period. But we need to do more of it, and we need to do more intelligent work, intelligent-led work, where we find out about families and target those families.
No, thank you. Hina.
Thank you, Chairman. I just want to pick up on what you've mentioned, Shika, about prevention, and in particular, I see in the report here it says that in the past maternity dental packs were routinely provided to new mothers on discharge. Is that still happening, or is that not happening anymore, or is that something that we need to kind of start doing again to ensure that new mothers have that information that Chairman just shared?
I'm not aware about the packs being given to toothbrushing packs being given to new mothers, but I think that would be a good initiative to prevent dental decay early on.
I mean, I've got a 3-year-old, and we weren't given a pack 3 years ago, so but it's something for us to look into.
Thank you, Chairman, and thank you to both for your great reports. 2 questions. The first one is, as it's fairly routine during antenatal classes to discuss all matters with mums-to-be, and nutrition, particularly around folic acid, etc. Are we missing a trick by not getting into the antenatal groups, the National Childbirth Trust? I don't know if there's anything being done with them.
We are currently, so public health team is a small team of 2 consultants, so we are currently looking into increasing access to Healthy Start program, which is giving vitamins, distributing vitamins to families in the highest need. What you say is absolutely true. Working, as I said earlier, working with maternity, when a woman is pregnant, she's captive audience. She wants to protect her child, and she wants to do everything to improve child health. So we do nationally funded program in smoking cessation, although not to the extent that we would like to, and other things. But as Councillor Denys has also highlighted, mums are not being given toothbrushing packs, and that's a gap.
Thank you, Chairman. Thank you for that answer. That's obviously something to be explored. My other question was with regard to spreading the message to the wider audience. Has a campaign across social media such as Mumsnet, Facebook, etc., because there's a lot of groups on there, being considered, because that's a relatively inexpensive way to reach a lot of people that have the same interest?
So through the Children and Young People's Group, there have been a number of campaigns, as are highlighted even during the COVID period, a lot of web-based activity. And I'm just reading off of what I received from the group. So National Smile Month 2020, Fill Hillingdon with Healthy Smiles, drawing competition. So these are different ways of engaging young families. Fizz-Free February 2021, competition encouraging children to give up fizzy drinks. Guinness Book of Records attempt. Sally engaged with young families to have the most people around the world brushing teeth March 2021. So she participated, ensured families from Hillingdon participated in that. And National Smile Month 2021, encouraging the whole family to design a healthy eating poster. So there are various ways. She regularly has sessions running with young families on various things, provides a web-based online training to school staff and early years staff. So there are campaigns and activities constantly going on. I participated in a video where she asked me to do a circle run around and put a smile on my face, and she's apparently used it somewhere. So there are a number of things which happen even during the COVID period. There is an active campaigns program.
Lovely, thank you very much.
I'm going to go to June first. June hasn't asked a question yet. So. Sorry, Jude. Can you just tell me your... Thank you very much. That's okay.
Got to get to grip with this. This is for Dr. Patel. Seeing that in your report you said you got 309,000 population in Hillingdon from your last statistic that you received, and only 33 dental practice. In the deprived area, those people in the deprivation area, how are those families able to access dental care if they're not registered with those practices?
So this data stems back to 2019. Now, as you asked early on, there's a big divide between north and south of Hillingdon, north of the A40 and south of the A40. North of the A40 is more affluent, south of the A40 is not so affluent. Hence, to answer that access problem that we had many years ago, 2 practices were opened south of the A40, which was one in Useley and one in Harefield, which then started accepting new patients. And that's how they managed to access dental services. But unfortunately, the existing practices, of which 33 are, and some of the practices, I'm not even sure that this data is more valid, or is there less number of practices doing NHS now, because I'm not privy to any of this data. I was just given this data by my federation. But what I'm trying to say is that a lot of people at a lot of practices, a lot of youngsters, young dentists nowadays, when they come to your practice, they don't want to do any NHS work. They want to do cosmetic stuff. They want to do private work. And hence they're disillusioned with the whole system. And we're losing a lot of young dentists who do not want to do any NHS work. I'm struggling to find a... I'm trying to recruit 2 new dentists in my practice, and I'm struggling to find somebody who's willing to do any UDA for me. So the problem is the system. And unfortunately, until the system changes, we're going to have this problem ongoing. And I have no magic answers to this, but yeah, I really don't have any answers to this.
We are thankful you're here answering us anyway. Thank you, June. Peter.
Oh no, I just wanted to say that I've got a 1-year-old, and my wife was offered some dental stuff at one of her appointments.
Oh, brilliant.
Yeah. So yeah, I think it's hit and miss though. So maybe have something in the framework to keep it consistent. But it's a no-brainer. Working with the maternity units. I mean, Hillingdon maternity unit's amazing. But yeah, it's a no-brainer. And we had a home birth, and we were given a lot more information. We've not had a hospital birth experience there, but the home birth team, amazing. They tell us everything, too much, but yeah, which is always good.
Dr. Patel.
Councillor Denys, can I just suggest that
yes,
maybe one of the members or a few of you can maybe attend this CYP meeting, because I wasn't aware of this CYP meeting until I took over the chairmanship of Hillingdon Dental Committee. Now, you should see the type of work they do, and you should see what Sally does and how they do the work and how they report. It's just amazing, and it was an eye-opener for me. And I suggest that if you get an invitation, or if you ask Sally to give you an invite, they've got a meeting tomorrow. Unfortunately, I can't attend that. But you see the kind of work they're doing in the background, and that really is an eye-opener as to how we can go forward in helping them or expanding their roles to alleviate this problem that we have.
Thank you. And I think ideally that would be great. I would suggest ultimately, if possible, certainly me and Peter as a Labour lead. If they've got space for more people, then that'd be fine. But Nikki, would that be something you'd be able to? I mean, tomorrow's probably too short notice, but the one after that, certainly myself and Peter at the very least. Oh yes, how often are they held? Do you know?
How often are they held?
I think every couple of months. Carol McLaughlin is the chair.
Yeah, so potentially the next one, yeah.
So I will send you the lead and the email for you to communicate with her, and then see if you can.
Yeah, no, send that to Nikki, and that'd be fantastic. Peter.
I mean, if no meetings with mine clash, I'm happy to attend tomorrow. I mean, if it's not too last minute, But
I mean, we'll have to. I mean, essentially, we'll have to be invited. So you'll have to contact. So if that could be, well, if we can be invited tomorrow, let me know because I might be able to attend as well. Is it online? Yes. Okay, so if it's online, there's what time of day are they? Yeah, what time of day are they? What? Sorry? Ooh. I might be able to attend that. Who knows? But yeah, if we can get in, yeah. If you could send Nikki the details for Carol now, that we'll see if we can. I was going to say gate crash, but that'll be very good. Thank you. Darren.
Hiya, a couple of questions. So, 600 packs of toothbrushes were given out to special needs schools. Would it not be beneficial just to get community dentists into these schools and do a couple of days a month or something like that, where the dentists are actually looking at the children's teeth and referring it back to the parents or to the schools or social workers? Because a lot of these schools have social care teams attached to them as well. That's open to anyone.
Sorry, I know Andrew hasn't spoken for a little while. I mean, maybe it's a bit difficult when you're online to sort of contribute. I mean, is that the kind of question that you'd be interested in answering?
Yeah, I possibly, but I didn't hear the question. It's quite hard to pick up.
Yeah, fair enough. A question was asked about is it a good option to maybe send community dentists into certain schools once every couple of months to obviously, I don't know, look at teeth or provide the fluoride? Is that a way of targeting?
Yes. I mean, if you go back quite a long time, then annual school screenings used to happen. So a community dentist would go into schools and do a brief look at every child's teeth. But one of the problems with that was that there was no link between that and then subsequent attendance. So people would often get a letter saying you should go to the dentist because the dentist noticed something, and it, the outcomes were not that good. The one area where we do that still is in SEN schools, special needs schools. So we tend to continue that process there. And I do know that we're also distributing brushing packs in those schools as well.
It just seems so strange to me that if this was another part of the body medical condition, the idea a parent wouldn't follow that up, or there'd be no sort of chasing or recourse. But suddenly, I just get this overall feeling that teeth is sort of missed out, really, as being as important. But obviously, I don't know. Yeah,
I think that's possibly true. It comes lower down the list of priorities. Yeah. For maybe families that have got, a lot of other more pressing issues, perhaps.
Yeah. Okay. Also, my second question.
Yeah.
During the COVID pandemic, I know personally that a lot of NHS dentists in my part of the borough weren't taking on new patients. So, do you think this has had a drastic effect on children's teeth? And is there a reason why, if we didn't have to register, why new patients weren't being accepted during the COVID pandemic?
Yeah, during the COVID pandemic, we had a backlog because we were told to close our practices on the 23rd of March to the 8th of June last year. So we had a backlog of we were just close to shut shop and go home. And we were told to open on the 8th of June without even giving us much more notice anyway. So we have a backlog of our own patients that we're seeing on the NHS who have dental problems, and we stop them mid-treatment, and we have how can I put it? We have an obligation to see them first, then see any new patients that are coming in. Hence, access and new patients were just a no-no for us to accept any new patients, because the working environment had changed, where we were told that there is a fallow time now because of the aerosol. The drill generates aerosols. So because of the aerosol generating procedure, if you do a filling or a crown or something in a room, you have to leave that room for half an hour, open all your windows, and then come back in half an hour to see the next patient after it's been cleaned. Now, you can imagine how much impact that would have on we were seeing patients every half an hour, 20 minutes or what. and we have to have enough surgeries to see X number of patients. So it's really impossible to see any new patients that would have come in through the door rather than see our own patients. And now, we're just about now getting to grips with sorting out all our emergencies that we had during that time and our regular patients. So unfortunately, you'll find that any dentist that you ring within either London or wherever will not accept any new NHS patients.
Okay, thank you.
And just to clarify, nobody has responsibility then to pick up or provide what is a service that the state is meant to be giving to, children. So, yeah, okay. It's interesting because if that was the case of GPs, I don't know, you wouldn't let that lie, would you? So, okay. Sorry, yes.
I just wanted to say that Health Watch has done a report and highlighted all the issues. I shouldn't say all the issues, but some of the issues for families, because these families are desperate and they are contacting health bodies like Health Watch and other local GPs. So they've taken a lot of pressure and NHS 111.
No, thank you. We invited Health Watch tonight, but they couldn't make it. But I was planning on setting up an online meeting, and obviously those councillors who wish to attend that to talk to them may do so. Okay, do we have any more questions at this moment in time? Oh, Nick.
Thank you, Chairman. Just one last little question relating to maternity. Do we know approximate uptake of the free dental care that's offered during pregnancy? Because that could be a good opportunity to discuss babies' dental health too.
I think most practices are accepting, most practices that have existing core of NHS patients, and if they're on maternity, they would explain all these beneficial factors to them. So unless it's a new patient who cannot get access to NHS service, I can't say for that. But within our practice ourselves, any pregnant mothers that come in, we explain to them how the gum's going to change and what's going to happen when the baby is born, and then we give them a leaflet explaining how to brush the baby's teeth as well, and then bring the baby in as soon as they have any teeth whatsoever, and then we'll just put them on our books and then see them.
So I think the key issue there, though, is, okay, if you're already going to the dentist and then you're pregnant, okay, fine, hey, you can do the NHS for 2 years, fantastic. But what about those women who are not registered with a dentist who become pregnant? Is they're told, okay, you can get free dental health care, and they say, they try and find some and they can't find anybody to take them on. What happens then? Do they have to cope?
They're lost in the system, unfortunately.
Do we have any numbers about how many women are lost in the system? Because, Nicola's right, that's a great opportunity to educate at that point. No.
I just want to say that data is available on how many women, what percentage of women access maternity within 12 weeks. So we can look that up. That data is available. The data about maternity service and how many don't access dentistry would not be available to us. Any NHS figures are not available to council people. Well, again, we can ask for it. But Chair, I also would like to say that if you decide to have a session with CYP group, I feel that maternity should be invited as well, because there's a lot of our discussion has been around maternity service. Thank you.
Thank you. Right, June.
On the topic of maternity services, do you work with clinics and maternity provision with the local hospitals in regards to that as public health, in oral health, for new mothers, so that they are aware that this is available to them, or guidance from the local clinics or health visitors?
I don't directly work with them, but at a strategic level, we do have conversations about what they should prioritize, and this is how I got to comment on Mother and Baby app and the need to include dental health, and also improvement in diet at an early stage at maternity, because there are other issues as well. Childhood obesity is another issue that we are trying to tackle, and there are all these factors are pointing towards poor nutrition in the borough. There is evidence of poor nutrition from my perspective, and I think we need to do more. So to answer your question, I would say we need to do more. We need to improve work around smoking cessation, which is another factor. We need to improve work around nutrition and also dental health with maternity. Thank you.
Nicola.
Thank you. How can we as a council help to get that message out for you to pregnant mums and ones that are sort of slipping between the cracks, as it were, not registered with a dentist, poor nutrition? If they're not registered with a dentist, then they may well not even be registered with an antenatal class. I know that the National Childbirth Trust is quite cost prohibitive for some of our poorer residents. So what fills the gap, and if there isn't something, what can we as a council do to help?
I think perhaps more community involvement work, reaching out into those communities which are not accessing services in general, and just hearing from them what the barriers are for them and helping them at that stage, at grassroots level, connecting them with services. So more targeted work is what I would say, alongside maternity service.
Sorry, just for Andrew's benefit, in case you weren't hearing that interesting discussion, we were just talking about reaching out to communities, especially in terms of those women who might not be able to get access to dental services while they're pregnant, because obviously that's a big missed opportunity in terms of education. I mean, do you have any views? Is this the kind of thing that you would have a view on, or if it's not, that's okay. I'm just letting you know, because I know sometimes you're not hearing what's going on. So
no, I mean, I think the original reason why women were eligible for free dental care up to 1 year after giving birth was precisely for that dual reason of providing care but also providing advice. I think NHS England might have access to the figures about how many courses of treatment were provided to women in that situation. But again, I think it comes down to your point before that. And it's a really good point. You don't have to think about your primary medical care needs. In other words, you think, okay, I've got this problem, I'll just go to my GP. And I think the difficulty is, and this isn't the fault of dentists. We've ended up with a system that's largely underfunded and that's restricted access. And one of the areas that it is most restricted for is provision of good quality paediatric dental care. And therefore, dentists have often become de-skilled throughout the years because it's not seen as the highest priority for practices to invest in. And that's not their fault. I think it's the nature of the contracts that they have.
Thank you. I mean, I just have this feeling that there's such a great network built in for other healthcare, aspects when you have a child or reaching out, that piggybacking some oral health stuff onto this. I don't know. I just have something for us to look into. My gut feeling is that's we don't want to we don't need to create new systems. We just need to be part of the current systems that work very well for your vaccinations that you need, for example, or the scans that you have and all this sort of stuff. I think there must be an opportunity to do that. But something for us to think about. Peter, you had your hand up.
It's fine, I'll hold fire for now. Thank you.
Brilliant. My favourite question of the night. No, I was joking. Right, okay, so I think, are we all happy to sort of finish tonight's session there? Okay, brilliant. Well, first of all, can I say thank you very much to our guests who have attended, even online as well, so hopefully, Andrew, you'll be freed relatively soon from your self-isolation. But thank you so much for coming in. We really appreciate it. I think it's been a really interesting session. So we're going to discuss our work plan now, which is a public thing, so you can stay if you wish to, but do not feel compelled to stay if you don't want to hear about our upcoming work.
I will take my leave. Thank you very much for the invite, and I don't see this as the end of, the process, perhaps the beginning, and I'm happy to contribute as we go forward. And if you need more information, just drop me a line.
Thank you very much.
Likewise, yes.
Thank you, Chair.
Okay, brilliant. Okay, right. So now we move on to item 8, which is our work programme. Now, my feeling is that we've made some good progress, but there's probably some more progress we could make, and there might be a couple of meetings we'll be able to have outside this forum where we can gain more information, but possibly another heavy witness session on this subject would be useful. So what I'm thinking, looking at our work programme, our next item on the 20th of July was going to be digital connectivity. Interesting topic for our future, but not actually pressing necessarily for next month. The type of subject that we can possibly put into a later edition, for example, on the 23rd of November, we only have one other item. So my suggestion is that actually next meeting we have a further meeting on the children's dental services, and we think about, because we've got suggested plenty new witnesses that we might be able to ask. So does that sound like a good idea to the rest of the committee? Are we happy with that? Brilliant, okay. And we'll find a place to move the digital connectivity point to. Okay, thank you. Apart from that, does anybody else have any views on the work programme as set out over next year? Sorry, and Nikki, of course, your views are very important on this because you actually put them all together.
Thank you, Chairman. It's just I wanted to ask about possible witnesses for the digital connectivity, but presumably if we're going to actually move the meeting, then we can deal with that a bit closer to the time. I do have a couple of other things I wanted to mention that aren't actually on the work programme as such, but are work of the committee. So you will have seen that I circulated a copy of the CNWL Quality Account Report for 2020-21 and the draft response. If all members are happy with that, then I will forward that on to CNWL. I've also had communication today from Hillingdon Hospital, from THH, about their quality account report. So they're the one trust that has to send us a copy of their report because they have their head office based within our borough. We are normally given 30 calendar days to respond, and they have to include our response, which is up to 1,000 words verbatim in their final report. Unfortunately, Hillingdon Hospital have been struggling to actually meet the deadline. They've had obviously a lot of other things going on at the moment, and hopefully we'll be getting the report to me on Monday night. The report still has to be submitted by them to whoever it is they need to submit it to by the 30th of June. So Monday's the 21st of June, so we're going to have quite a tight turnaround time. I'm hoping to get a draft response. I'll get the actual report to you as soon as I get it, and I'll draft a response as quickly as I can. Hopefully it should be by Wednesday lunchtime. That's the plan. So if members can get back to me with any comments, thoughts, suggested amendments, suggestions for inclusion, probably by the Monday, which I think is the 28th, I would be very grateful. And the only other thing I wanted to mention was we are now a new committee, new municipal year, and welcome to the new members that haven't been on this committee before. In the past, what we've done is had a different member who has primary, not responsibility, but a primary focus on keeping track of a particular trust or organisation. There is a proposal we continue to do that. So whilst when we get to a meeting, if, what I've suggested is that Councillor Davies is London Ambulance Service. If when we get to a meeting with London Ambulance Service, everybody else has millions of questions, that's great. But we know that at least one person, Councillor Davies, would actually have a lot of questions and know the organisation really well. So there would be a different organisation allocated to each member if members are happy with this. If they're not, that's fine too. But that's worked quite well in the past.
I mean, just to clarify, because the health remit is so huge, I mean, I thought the council was a complicated organisation when I started looking at local NHS provision and how that's done. It just sort of helps a bit our work. So it doesn't mean, obviously, Hillingdon Hospital is a massive area. It doesn't mean we can't all take an interest and ask questions about Hillingdon Hospital. But at least we know, at least one person will know a bit about one area, so at least we can do the scrutiny across all the sort of service providers. So.
So the proposal would be that Councillor Davies would do London Ambulance Service, Councillor Arnold would continue with Hillingdon Hospital, and because it's the primary trust or the primary acute trust in the borough, I'd also suggest that Councillor Money be on Hillingdon Hospital, be on them, be focusing on them. Then Councillor Denys would continue with CNWL, Councillor Nelson continue with Royal Brompton and Harefield, Councillor Radia, who's not here, to continue with CCG, and Councillor Makwana. We have a new body, which is Hillingdon Health and Care Partners. Our she won't thank me for saying that, our old managing director of the CCG, the Hillingdon CCG, has now taken up the managing director post at Hillingdon Health and Care Partners. So I don't know if you know much about them at all already, but it's a really useful organisation. I think you did you describe them as a mediator, I think.
Yeah, sort of a facilitator.
Yeah.
So just very briefly, because we all want to go home, don't we? But essentially, it's a new way of trying to deliver health services, and so we have all these different groups who sort of do similar things and different things, and there's confusion. So what they've done is they've created a role for one person to almost be like the broker and negotiator and facilitator to make sure that all these different groups work together well. And actually, I think Caroline would be perfect to talk about this subject actually as well. And we're actually going to have a single meeting in February looking at how this system's working, because it got set up only a few months ago, and essentially it should deliver better streamlined care across Hillingdon. But we agreed with Caroline that we'd look at it in February after she's had a year to sort of get to grips with it all. So it's a really interesting initiative which I hope will work. So I mean, maybe if you could connect Hina and Caroline, so maybe they could have an introductory meeting, that would be very useful. That's it, brilliant. I have one other quick thing to add. So obviously Hillingdon Hospital's rebuild is a big piece of work for us as well, and for those new council members who haven't watched our meeting on the 28th of April that we did, the middle third of that was all about the rebuild and where we're at, and I think it's a really interesting watch if you want to know what's going on with that. So but I've just been informed that the public consultation is going to go live on Tuesday, where they're going to have a website which is going to have graphics on and plans and all this sort of stuff. So I've been invited to a preview on Monday. I was initially excited, thinking I was going to go somewhere and look at little matchstick men and buildings and have canapes and champagne, but apparently that's virtual as well. Of course, I could provide my own canapes and champagne. It is at 10 a.m, but I don't know, working from home changes one. But anyway, that's going live from Tuesday, and I'd advise everybody in the committee to have a look at it at some point over the next couple of weeks, because that is one of the big areas where we're sort of scrutinising the trust on.
Chair, sorry, what was the meeting? You said it was a good watch?
Sorry, the 28th of April.
28th of April.
So on the 28th of April, we had 3 agenda items. One was about moving the Mount Cancer Mount Vernon Cancer, which is, you know, an important issue, but, you know, for another day. Then we had a big presentation on the Hillingdon Hospital rebuild, where they're at, what they're planning, and then we had a third bit on Hillingdon Hospital's regulatory performance, which we look at as well. So, but the middle part I would highly recommend to people, because, you know, it is really interesting, and obviously what happens with the hospital is going to be so important to many people.
Thanks.
Okay, great. So if nobody else wants to say anything, I'm happy to draw this meeting to a close. Have I covered everything? Brilliant. Okay. Well, thank you everybody for attending and watching.